So clearly, the situation in the United States is a massive cause for concern, but it is not alone in experiencing a worrying surge in cases. As the virus has spread, many countries have been able to control it to the extent that they have passed the peak of infections, with new cases now either flattened or in decline. The US appeared to be on a similar path, as you can see, until earlier this month, when the numbers began rising again. Just as alarming is the picture from Brazil, which has the second highest number of cases in the world, and India. Both are seeing infections rise, with no sign at all of the curve flattening. And there are fears about what will happen next, with the World Health Organization warning today that globally the worst is yet to come.
This is the world's largest COVID medical facility. The Sardar Patel Hospital in South Delhi spans an area equivalent to 20 football pitches. It's 10 times bigger than any COVID facility in China. It's just become operational. The staff receive a final briefing before the doors are opened and the first patients begin to arrive.
The full strength is almost 10,000. So the Deputy Commissioner has told it will be ready within the next 4 or 5 days. As on today, we can admit 2,000 immediately.
It's just one sign how countries like India, which has over 500,000 recorded cases of corona so far, is preparing for what it believes could be a far quicker rise in the virus's spread. 6 months on from when it heard of the first case, today the World Health Organization gave a sobering warning, saying the worst was yet to come and that the virus is not close to being over. Having just passed the grim milestone of 500,000 deaths, no part of humanity and no region is immune or safe. And Latin America is now the new front line in the global battle against coronavirus, with Brazil at the epicenter of a frightening rise in new cases. Sao Paulo's densely packed favelas is a perfect setting for the easy and rapid transmission of coronavirus. Gilson Rodriguez, a community leader of Paraisópolis favela, says that children, if contaminated, are one of the highest transmitters of COVID, and the only way to prevent that is by wearing masks. So we are conducting a task force to make masks for children and are distributing it to them. One of the most vulnerable parts of the world is sub-Saharan Africa. This is a medical war dealing with coronavirus in the Somali capital Mogadishu, and it's a reminder of how fragile and under-resourced health systems in Africa are. The spread of corona is on the rise in Africa too, and the real fear is that a time will come when the continent's health systems will simply not be able to cope anymore.
The capacity of the health system in most of our countries would not be able to cope with a huge increase in people needing treatment and care, particularly beyond the capitals. So if you go into the hinterland, into the districts and provinces in countries, the capacity of our health systems is very inadequate.
Although South Africa is the continent's most advanced economy, it's been hit the hardest by coronavirus, accounting for 25% of all cases in Africa. The lockdown has meant that the informal markets and jobs that sustained millions has disappeared, leading many to go hungry. Ragioma, News at 10.
Well, it was, of course, in China that it all began. There, after battling long and hard to overcome it, any indication the virus could return has prompted swift action. In Anshin County near Beijing, more than 400,000 people have been told to stay at home after a small number of cases was detected. Well, Debbie joins us now from Beijing. It's obviously early morning there. Debbie, look, it's very disheartening, I think, for the rest of the world. We thought China, to some extent, was through this. So how worried are the authorities about a second wave?
Well, it is, of course, the threat that we are all facing, and what we're seeing here in Beijing and other affected areas are tactics similar to those which were deployed in Wuhan at the end of January. But the authorities now are acting swiftly and decisively to isolate and contain even a single case in a community. Anshin County to the south of Beijing, the latest to be sealed off after a few cases linked to the market outbreak here in Beijing were identified there. Almost 500,000 people forced back into their homes, into quarantine, with just one person per household allowed out for essential shopping. They are still working to identify the exact source of this outbreak. In 2 weeks, it has produced just over 300 confirmed cases, but 8.5 million people have so far been tested. Anyone connected with the market, their close contacts, all people working in the food and beverage industry, including delivery drivers. They are testing tens of thousands of people every day. What they are working to do is not to mitigate this virus, they are working to eliminate it completely and the threat of that second wave, not just now, but later in the year.
Okay, Debbie, thank you very much indeed. Well, back here, and even with